Afternoon, welcome back to another video. In today's video I'm going to be talking about something that I feel like a lot of people are going to be considering and going through right now, and that is graduate ideas and options for psychology graduates in particular. So obviously it is now getting to that time of year where people who are doing their bachelor's degree are starting to round up, dissertations. I feel sorry for you guys because I can relate, and it's stressful. And I remember when I was finishing off my bachelor's degree, kind of not really knowing like what direction to take or like what to do next. And I feel like with universities, I can talk about the UK anyway and my own experience, there wasn't, for me, a lot of support, and I feel like there wasn't really a lot of direction in terms of like knowing what to do next. So that's what I'm going to talk about today, so let's get started. By the way, how cute is this top from Zara? I picked it up yesterday. It was only £5, but it's literally like the cutest little basic vest top. Like, it is adorable. Anyway, the first thing I wanted to touch upon is when you are graduating and you're looking into graduate options, don't feel limited to stay within psychology when you graduate. Ironically enough, only around 20% of people who have a bachelor's degree in psychology then go on to pursue a degree or a career, in psychology. And there's a number of reasons for that, but I'll get into that a little bit more later in the video. But the first thing I wanted to say, and I've got a list here because I wanted to make sure I knew what I was talking about, so I could actually inform you guys. If you see me looking over, I'm just looking at my list. But the first thing I wanted to talk about is that there are actually so many different options that you can go into aside from becoming a psychologist with a psychology BSc. Well, mine was a BSc. I'm assuming it's the same if it's a BA in the UK. The first thing is psychology degrees are great. Again, I can only talk about it from a BSc perspective. If you've done a BA, comment down below and let me know like some of the things that you guys did. But with a psychology BSc, you learn a lot of transferable skills. And what do employers like? Transferable skills. So for example, with most psychology BScs, you have to have the statistics modules, which you then use the information you learned to then carry out your research dissertation and do all the statistical analysis. I learned SPSS, which was great and not so great. But with that stats knowledge, obviously it is kind of, I don't want to say basic, because obviously like people who then go into research assistant roles and they use like R, which is another software I used during my masters, and like when you do like ANOVAs and just all of that kind of stuff, like regressions, it's complicated. But the basis that you learn in terms of statistics can be transferable to many different careers. So that's one very good thing about having a psych BSc. The next thing I wanted to touch upon is some other careers. So I did a little bit of research online and I'm going to show you what I found just so you guys know the options that are out there. So some of the most common fields that psychology graduates go into, aside from obviously the psychological aspects and becoming a psychologist, are human resources, so HR. If you work in any company, there's always a HR department, and they're kind of the ones who deal with like you as an employee and your experience within that company. So for example, if you have a complaint, if there's someone in your company or your work who's giving you some issues, whether that's they're just being a general or they're being like racist even, or like sexist, inappropriate, job misconduct, go to HR. So this is what you'd be doing. Surprisingly, one of the next most common things that psychology graduates actually do in the UK is go into nursing, which I was actually quite surprised about. But I mean, I guess you can study a degree for 3 years and then realise that this is not actually for you and it's not actually something that you want to do. And there's always a demand for nursing. I've worked in a hospital before, and actually working with nurses on a ward for 12 hours a a day made me have this new appreciation for nurses that I had, but I it grew because they do a lot. Apparently nursing is like the next most common field, although just know if you do want to go into nursing and you have a psychology BSc or BA, you will need to do additional study. Like, you can't just become a nurse with your psychology degree because you haven't learned anything about nursing, so keep that in mind. The next was actually teaching, which is not that surprising to me. For like a lot of teaching positions, you would do like your first degree and then you can then go and do like specific courses to go into teaching. So I know in the UK we have something called Teach First, which one person I know actually did after her BSc. Now she's a teacher in a secondary school and she is loving it, so that's also another option. The fourth thing I found that is most common is actually going into marketing, and considering the climate we live in now with like such a big technological age and social media age, that doesn't really surprise me that marketing was quite a common position that people go into. There's a lot you can do with marketing and obviously a lot of different areas, but again, you need to look into that a little bit further. And then the final ones I found that are most common are public relations and business and welfare sectors. So again, if you have a psychology bachelor's degree and you're not looking to become a psychologist, fair enough, 80% of people aren't. Have a look, you know, have a browse, like look at different entry-level positions that you have the transferable skills for, because trust me, there's a lot of other jobs and companies that are looking for psychology graduates that I have not even mentioned. If you don't want to go into psychology, please don't feel pressured. Have a browse and even talk to some of the people at your university in terms of like your lecturers and your professors and any other psychology graduates that you do know, because again, 80% of people with a psychology degree do not pursue psychology, so you aren't going to be jobless. Next, I want to talk about what you can do if you actually do want to stay in psychology like I did. So it can be really daunting, again, like when you finish your psychology bachelor's, to actually figure out like what you want to do, or even like what kind of psychologist you want to become. So I would say if you are studying a psychology bachelor's degree and you are just about to graduate, obviously the first thing you need to start thinking of is how you're going to get your foot in the door, because becoming a psychologist or even any other type of mental health care professional is difficult. A lot of people will tell you like how great it is to become like a HCA, for example, so a healthcare assistant, and that doesn't necessarily, I feel like when you say like care assistant or healthcare assistant, people automatically just like picture working with old people in like elderly homes. Yes, that is good experience, however it's definitely not for everyone. Working with like individuals with dementia, for example, is very challenging, and there are things you might have to do in the job role, such as like personal care, which does involve like changing people and wiping their bum and, you know, dealing with stuff like that. So I know that people who are looking for psychology experience and maybe like mental health experience, some people might like it, but for a lot of others, working in that kind of environment isn't necessarily going to be what you might want. And I'm not saying like fresh out of uni be selective, but I do feel like your time is precious, and at the end of the day you don't really want to be in a lot of roles for like a small period of time, because you're finding you don't like this and then you don't like that and then you don't like that. By no means I'm saying stay in something you hate, but it's better to kind of have a grounding and try and enter something that you know you might at least like. So with being a healthcare assistant, there are other fields that you can be a healthcare assistant in. So for example, a hospital, there's a lot of like acute wards, inpatient facilities, day centres, even like supported accommodation places that look for HCAs, and you can get mental health experience that way. So you might be working on like an eating disorders ward like I was, or you could be working in like a psychiatric intensive care unit as a HCA. And what you will do as a HCA completely depends on where you're working. Like the job role is very variable, but typically you are part of the nursing team. You have to answer to the nurse in charge, and depending on the type of facility you work in, again, the types of people, service users you interact with will differ as well. It's just about helping to support them through the day. Again, being a HCA is very varied, but I feel like it's a great thing to do when you first graduate, because a lot of people will be graduating with no experience whatsoever. I would say a HCA is a great way to start, and also you learn a lot. Like, it's what I will say one thing. It is one thing to learn, let's talk about from a mental health perspective. It is one thing, right, to learn about mental health, and a completely different thing working with individuals with mental health issues or mental health disorders or mental health illness. Completely different, because when you're learning about things in textbook, especially with a psychology degree, a lot of it is all research based. You're reading articles, you're reading books about this, that and the other. But when you actually work with individuals with these problems, you have to counter in the fact that they are human and they have their own personality before their disorder or before their illness or before their problem. So a lot of things to consider. It can be challenging, very, very challenging, especially if you're a HCA in like a hospital, for example, and you are working 12-hour shifts like I was. It can be hard. But it's eye-opening, and I feel like it will also give you a little bit of a taster into if this kind of career is for you, because if you aren't enjoying working with individuals with mental health problems as a HCA, that's not to say you won't enjoy it as a psychologist or a high-intensity CBT therapist, because obviously the job role is immensely different. But it's kind of like the crucial foundation. You have to enjoy working with people, because the higher up you get in your career, the more challenging it's going to get, the more demanding it's going to get, and the more responsibility you are going to get. And as a healthcare practitioner, whether that's mental health, physical health, holistic health, whatever, I always feel like you kind of have like people's lives in your hand. Like, not literally, like I'm not like a brain surgeon or anything, but like people are trusting you, you know, like your employers are trusting you, and you can't just willy-nilly wander around and not care about what you're doing, because it will affect these people. So to start off with, I would say healthcare assistant, great thing to consider. After that, another thing that a lot of psychology graduates and students will be aware of is the assistant psychologist. I remember when I first finished my BSc, I thought I was going to finish and then I was going to get an assistant psychologist role in the next 6 months. Still hasn't happened. But don't get me wrong, I have been doing other things. It's just assistant psychologist roles are very difficult to get. There could be one role, and usually they're fixed term, not all the time, but usually are fixed term. Could be one role for like an 18-month fixed term contract as an assistant psychologist. And for that one role, it's really hot in my room. For that one role, there could be over 100 applicants. I literally had an interview actually about a month ago for an AP role. It was like working with like looked after children. Told me I got shortlisted to the top 3, and they had I think it was 70 applicants, and that wasn't the NHS. It was for like a small private company. So you can imagine how many applicants NHS roles get. But I will say, even though I have never been an assistant psychologist, I took a different route. I'm working in IAPT, which is improving access to psychological therapies. Talk about that soon. Even though I've never been an assistant psychologist, I'm not gonna slate it. Why would I? It is very, very good experience and very, very good opportunity to have and to try and pursue if that's something you're interested in. I know a few assistant psychologists, and I will say like one very good thing, especially if you're thinking of going on to do the doctorate, is that when you are an AP, you typically are working with actual psychologists, and you're doing some of the work or tasks, obviously, that are suitable, that a psychologist might do. So you get like very good exposure of what you would be doing if you were a psychologist, whereas other roles, so for example working in IAPT, you may not necessarily be working directly with psychologists. You're more likely going to be working with high intensity CBT therapists, and obviously it's in the name, they specialize in CBT, which not every psychologist is even going to necessarily use all the time, because they can use so many other different modalities of treatment. So having an AP role is definitely a very advantageous thing, and all I can say is good luck. I'm joking, but make sure when you are applying, it would be good to talk to previous APs, previous psychologists. Make sure you're reading the job description properly, and don't be discouraged if you don't get the role. Just keep applying if that is something you want, and in the meantime you can pursue something else. So I'm also going to talk a little bit about IAPT because I feel like this is something that is actually very helpful. So I'll give a bit of context. I did my bachelor's degree in psychology. It was actually psychology with clinical approaches. So I had like a pathway which was clinical approaches, which basically just meant it was psychology with extra clinical psychology. And then I did my master's in mental health studies, and I went to the opening day. I went to King's College London for my master's. Absolutely love that uni. Institute of Psychology, Psychiatry and Neuroscience is... But anyway, I went there for my master's degree, and me and my friend actually went to the DCLIN Psy open day. If you don't know what the DCLIN Psy is, it's basically just the doctorate in clinical psychology, which is the 3-year doctoral program you need to do in the UK to become a clinical psychologist. We went to the DCLIN Psy open day at King's College London, me and my friend, and one thing that I found really interesting was that particular year, I think it was that year, in fact scrap that, let's not say that particular year, but for one of their years I remember them saying something like 60% of their applicants that were successful on the DCLIN Psy were psychological wellbeing practitioners prior. 60%. That is a very high percentage. So with IAPT, it's basically services or a service that we have in the UK, and each borough will typically have their own. And with these IAPT services, they have different clinicians. So IAPT typically treats like mood disorders, so like anxiety, depression, OCD. They can treat some forms of trauma or PTSD, things like that, social anxiety, health anxiety, things like that. Like if you have like an eating disorder, or if you have psychosis, or if you have like autism or ADHD, you wouldn't get treated at an IAPT service. And within IAPT, it's really good because obviously I know every IAPT service slightly differs, so I can't talk for every IAPT service, but you can become a psychological wellbeing practitioner in an IAPT service, which basically means that you get trained to treat mild to moderate mental health problems, again, such as anxiety, depression, OCD, panic disorder. With the PWP contract, it's a training contract is 12 months. You can apply to a few different IAPT services, and obviously you then see which ones you're successful for and pick. And the training contract is a year, and in this year, again, each IAPT service will differ with like how many clinical and how many uni days you have and where you're even going to uni. But it's basically a training course, so you get paid a full-time salary and you train for however many days. Let's say you train for 3 days, so in those 3 days you're actually working, and then for 2 days you're studying at your university and you're learning. And after this training contract, you then apply for like the qualified role, and you're a psychological wellbeing practitioner, and you would usually use guided self-help cognitive behavioral therapy, which is a form of CBT, but it's just, there's different forms of CBT. You have online, you have guided self-help, you have high intensity. PWPs, obviously they can't do high intensity, but they usually do guided self-help and online and some other things such as psychiatric assessments. But what's really good with a PWP is, again, it boosts your chances of getting onto the doctorate at a later stage. It also gives you a registered qualification. It opens up many more doors once you have that like registration as well. But also another good thing with the PWP is once you have done that and you have experience in CBT, you're working as a practitioner, you're treating people with anxiety, depression, OCD, panic, helping transform lives. Within that IAPT service, there's actually room for progression. So you can actually then go on to train to become a high intensity CBT therapist, which is basically, let's call it a ladder. It's one step up the ladder in an IAPT service. And with high intensity CBT therapist, again, you work in an IAPT service, obviously your salary increases a lot compared to PWP, but you're no longer doing guided self-help CBT or online CBT. You're now doing high intensity CBT. So the sessions are longer, more in depth, more complex, more homework tasks, more behavioural tasks. And also at this level, you obviously treat a higher complexity as well. And another great thing actually is as a HI, you can become trained to do EMDR, which is eye movement desensitization therapy or something. EMDR, and it's a type of therapy that is used to treat PTSD and like typically like single trauma event related disorders. So you have the option to train to be able to deliver that as well as a HI. So you're not only doing high intensity CBT, but you can also deliver EMDR, which just makes your job more interesting. As a graduate, have a look at IAP services. Is there anything you're interested in? Maybe you can get some experience to then later apply for the PWP, but it's just something to consider. So anyway, let's say you've chosen one of the things I've spoken about. So you've had your time as a HCA, you've had your time as a PWP, you've had your time as a HI, you've had your time as an assistant psychologist, and you now decide, I want to be a licensed psychologist. Because none of those things are, by the way, none of them are psychologists. In the UK, in order to be a psychologist, I'm pretty sure it's like this with any kind of psychologist, you need to do a doctorate or a PhD. They are slightly different, but a lot of them you need to do a doctorate, which is basically, again, 3 years of training. For example, the clinical psychology doctorate at King's is 3 years, and within those 3 years, it comprises of six month placements. Yes, six month placements, and these will differ depending on the university you go to and the type of course that you do. But one thing I actually briefly wanted to touch upon is I feel like when people talk about being a psychologist, people's minds always go straight to like what I would know as a clinical psychologist, they would just think of as a psychologist, but like a type of psychologist that just treats mental health disorders. But there are many different types of psychologists. You have a clinical psychologist, and with a clinical psychologist, you need to do a doctorate in clinical psychology, which is 3 years long, and you can actually get an NHS funded space in the UK, but it's very difficult. Typically, there's only maybe 21 spaces in most universities, and they could get anything from 900 to 1,000 applicants, maybe more, and then those applicants then need to be shortlisted for interview, series of interviews, and then later you find out if you've become successful. But yeah, there are different types of psychologists. Clinical psychologists usually assess and treat mental health disorders. You then have another type of psychologist, which is called a counselling psychologist. There aren't NHS funded spaces for this course as far as I know, for the doctoral course as far as I know in the UK. So that is something to consider. The counselling psychologist, they do a lot of similar things that a clinical psychologist does as well. However, their focus, from what I've been told, is they tend to focus a little bit more like mental health disturbances, emotional problems, social problems, behavioural problems, and typically, not always, they may treat like less severe mental health problems. So you have clinical psychologists and you have counselling psychologists. Those are two different types of psychologists. Another type of psychologist is a developmental psychologist, and during my first degree I actually absolutely loved developmental psychology. I remember doing the exam, and I think I'd done like my essay on like postnatal depression or something, I don't know, but I loved it. And I actually almost done my master's in clinical neurodevelopmental studies. I actually got accepted onto the program, but I chose mental health studies instead. But yeah, I love developmental psychology. It's so interesting. Basically, these types of psychologists usually like research development across lifespan, so that could be from like childhood to adulthood, and they may also like evaluate and then treat like any developmental delays. One thing I will say, not all of these degrees, like these doctoral degrees to become these different types of psychologists, require masters, but some of them do, which is a forensic psychologist. If you want to be a forensic psychologist, you need the 3-year bachelor's degree in psychology, and then you need to do a master's degree that is BPS accredited, so British Psychological Society accredited, and then you would need to do the doctorate in forensic psychology. Forensic psychologists usually look at like the relationship between like psychology and law. The next one I want to talk about is a health psychologist. The reason I say this is because I've always liked health psychology. I've always liked health psychology and clinical psychology. Just to put it out there, I've taken the clinical route, I guess, but there are kind of regrets within me about like not doing my master's in clinicals in health psychology, because in order to be a health psychologist, you need, again, the bachelor's degree in psychology, but then you need to do a master's degree in health psychology specifically. So if you don't have a master's degree in health psychology, you can't be a health psychologist. And then after you've done the master's degree, you then go off and do the 3-year doctoral study in health psychology again. And with health psychology, the reason I like it a lot is because it looks at like the relationship between like psychology, like biology, and like the social aspects as well. So like it's not just mental health, it's very much looking at like well-being from like a broader perspective. And I don't know, I just find it really interesting. And they look at like social groups and behavior and how it may influence like overall well-being and illness and health. And they work to like maximize physical health and mental well-being and general health. I think before any of you graduates out there start considering like any master's degrees, I think have a look into what you think you'd want to do with that master's degree, because there's a lot of great universities. I'm going to plug King's again, King's College London. In the Institute of Psychiatry, Psychology and Neuroscience, they have a lot of different master's degrees, but not all of them are like transferable to then help you become like a certain type of psychologist. Obviously it's not the end of the world if you don't do a master's, or if you do a master's in one thing and then decide you want to be a certain type of psychologist that requires another master's. You're young. A master's degree typically is only 1 to 2 years, so mine was only 1 year. They're typically only 1 to 2 years, so it's not going to take up a lot of time in your life anyway. It's just more like getting the funding if you've already done one and you decide to do a different one. That's what you have to consider, but nothing is impossible. And people do things all the time. Like, I think about how many people go into like postgraduate medicine, for example, and they might not have funding for that and they fund it themselves. So don't be disheartened, but I will say, just try and think about your decision before you take on the master's degree. One thing actually I've just realized I forgot to mention is, if you don't want to be a clinician, you can go into research. And like one great way to get into that is to actually become a research assistant. Research assistant roles in the UK actually seem to pay a lot, because like I said, studying psychology and then working as a mental health practitioner are very, very, very different. And you might find that you're more interested in like the behind the scenes stuff. So even better developing different forms of therapy. So for example, with CBT, everyone will tell you it's the most evidence-based form of therapy for treating affective disorders and mood disorders. Well, there are people around that who gathered that evidence. That could be you. But yeah, I don't want this video to be too long, and there's obviously a lot of different things to touch upon and a lot of things I could go into depth upon, but obviously I won't. I've just put out some very, very quick fire information. And the last thing I want to stress is that as a graduate, if you do decide to become a clinician, let's just keep it as that for now, because that's the route I've taken. I think one thing to remember is, let's say you're working in mental health, your mental health matters just as much as the people you're treating. Like, you can't look after someone if you're not looking after yourself. And I think, especially with this pandemic, and this isn't just psychologists or PWPs or high intensity CBT therapists, this is doctors, this is psychiatrists, this is nurses, this is anyone working within like healthcare really. I feel like it's been difficult, and even without the pandemic it is difficult, like working in this kind of environment where like you kind of always are very hyper aware of people's problems and people's issues. So like 5 days a week I'm always reading about someone being depressed and about something sad that's happened to someone and about like a lot of negativity. And obviously it's not these people's fault. It's very brave and very admirable of them coming forward for help, and I completely commend it. And honestly, it is nice to know that you're making a difference, especially when people tell you that. But I will say it's also very important to like prioritize your own mental health. And if you find that you've gone down a field or a career or a route that you thought you were really gonna like after graduating, and you're a year and a half in and you realize, you know what, I don't like working in ADHD, or I find working with children quite challenging and I'd rather leave CAMS and work with adults, don't be afraid to make that switch, because it can be very difficult to like not take like work home, or like not take that work stress home. And I've literally had dreams about the hospital, and I've had dreams about like things that like my patients have told me have happened. I had dreams about them and like woken up in the middle of the night like, oh. So it's important to like think about your own mental health and not put a lot of pressure on yourself, because at the end of the day, once you find that thing that you're really passionate about and you love, it's not going to feel like work. That's a cliche, and I know any job will be stressful, especially the higher up you get in that role. But for example, for me, I have found I absolutely love eating disorders. How many times am I going to say that? But I do. And obviously I'm not working in eating disorders at the moment, and the only reason I left that hospital was wasn't because of the hospital or because of the patients or their like psychiatric problem. It was the actual job role. There wasn't enough psychology in the role I was in. It was very nursing based, which is why I left for a more psychological role. Now I know that with eating disorders, it's something that I'm passionate about, it's something I'm interested in, and I also like the fact that it's not just mental health, there's like a physical health aspect, and also, I don't know, it's just something that resonates with me. I like when I did work in the hospital, I liked helping the patients look at like their relationship with food and like body image and where that stems from, where that comes from, even more like social things, like helping them learn to like eat again in public if they can't do that, or like just helping to change their relationship with food. And for me, yes, it was stressful, and yes, if I do, by the grace of God, become a clinical psychologist one day and go into eating disorders, it's going to be even more stressful, because I will be their psychologist giving them therapy, trying to help them. But I know that even though it'll be stressful, it's something that I'm actually interested in and something I want to help with. And just keep going until you find something you do love, and that might not even be in psychology. You might pursue a career to one day become a psychologist, and you're doing that PWP and you realize, you know what, I don't want to work in mental health anymore, and that's fine. It's about finding what you do want to do. And to be fair, when you first finish uni, you are still young. Like, you've most likely never worked full-time before, and if you have, it's just been in roles that you can work full-time in whilst you're at uni, so it wouldn't be stuff that you can actually use your graduated degree for. So you have time, and there's a lot of things to figure out. You will get there, I will get there. I'm only 24, just turned 24 about 4 months ago now, so I'm still kind of young. It'd be good to look back at this video when I'm 30 and see if I actually I'm a clinical psychologist, but I guess we'll see. But yeah, I think that's it for today, because otherwise I'm going to be talking your ear off for probably the next hour, because I talk a lot. But these are just some of my, I don't want to call it tips and tricks, but just my thoughts on what I feel like would have been helpful to hear when I was graduating from psychology, and just seeing a bit more of the options and what is out there. So I hope you have enjoyed this video and enjoyed listening to me go on, and there'll be more videos to come. Obviously not everything's going to be psychology related, but I am liking the whole vibe of doing like educational videos, but then also like vlogs, and like that other video I done about like soothing the anxious mind, that was really fun to make. So stay tuned for some more videos on my channel, and until then, check out my Instagram. Artlist.io. I hate me too, I can always tell when you're lying, girl, you're see-through. All these miles away, yeah, I just wanna see you. Baby, give me good face, she hit me like